The coronavirus outbreak in Europe is rapidly intensifying, and the number of infections across the continent is also rising fast. Italy, the worst affected country, is beginning a second day of lockdowns. Death rose by a third on Tuesday. We're now looking at 631 people. There have now been more than 10,000 people infected with the virus in Italy. Here in the UK, a health minister has tested positive for the virus as the government prepares to announce its annual budget. Britain's central bank in the last few hours slashing interest rates by 0.5%. In China, the picture does seem to be improving, with the number of reported new infections actually continuing to fall. Globally, though, the number of confirmed cases of COVID-19 now stands at almost 120,000. 80,000 of those in China. More than 4,200 people have died. Well, European leaders have been updating their countries on the coronavirus outbreak in the last hour. We've been hearing from Germany's Chancellor Angela Merkel, who said experts had told her that between 60 and 70% of people were likely to be affected. It's now all about slowing the spread of the virus. And Italy's Prime Minister Giuseppe Conte has also been giving an update, responding from a request from the worst hit region of Lombardy to implement even more stringent measures to stop the spread of the illness.
I've already declared on behalf of the government that we are not closed to the idea of adopting more restrictive measures. Although let's bear in mind that the day before yesterday we did introduce some restrictive measures for the whole country. But we are happy to follow the requests based on the curve of the virus contagions. The only thing I would say, and this isn't so much directed to the governors who know their areas and put in requests that are based on fact, but to those who are participating in public debate. I invite you to proceed with caution and a sense of responsibility. Our primary objective, and everyone shares this, is the health of our citizens, because compared to other interests, even on a constitutional level, it's our priority. But let's remember that there are also other interests at play, like civil liberties, social rights, and freedom of enterprise.
Italy's Prime Minister there with that update in the last hour. Well, let's take you to Rome and join the BBC's Bethany Bell, who is there. Bethany, can you tell us what restrictions are in place at the moment across Italy and whether people are obeying the rules?
Well, under this decree, people can't move from one town to another unless they have essential work reasons, unless they have health problems, or there's a family emergency that they need to go and rejoin their family, or they need to be able to get home. And if you do wish to travel from city to city, you have to fill out a special form justifying your reasons for doing so. And if you lie about that, you could face criminal sanctions for that. Elsewhere, shops are allowed to be open, but people have to maintain a meter's distance from one another. Cafes and restaurants are open from 6 a.m. to 6 p.m. But things are shutting down. A lot of people are cancelling events. Big public events have been cancelled. Just close to where I am now, St. Peter's Square in the Vatican has been closed to groups and tourists, and really a sense here of life very, very strange. About as to whether people are obeying these things, very hard to tell at the moment, and quite an individual thing. And we haven't seen that much evidence of how the authorities are enforcing this at the moment.
Bethany, we've just been hearing from Italy's Prime Minister, who said there could be even stricter rules brought in for Lombardy, which is the worst affected region in Italy. How is the health system in Lombardy coping, given the amount of new infections and new patients they're having to deal with every day?
It's under immense strain. Italy has a very well-developed health system, particularly in northern regions like Lombardy. But the pressures on that system at the moment, because of so many people needing treatment in intensive care, is making things extremely hard for doctors. One of them described it as a kind of war situation that they were facing. And we've seen pictures of beds, intensive care beds, actually in hospital corridors. And the fear was, and what we understand is that one of the reasons why the decision was taken to put the whole of Italy under this kind of lockdown was because they didn't want to see the virus spreading more in the south of the country, where the medical systems are not in such good shape as those in the north. But this is a time when medical staff are under an enormous pressure. All leave has been cancelled. Their fears that they're getting tired, and what will happen if the numbers just continue to grow.
Bethany, thanks for joining us from Rome, and we'll be returning to Italy shortly to hear from a resident who is under lockdown with her children about what life is like. But while Italy is taking these emergency measures across the entire country, the UK has taken an extraordinary financial step. At 7 a.m. local time, the Bank of England said it was cutting interest rates from 0.75% to just 0.25%. It's intended to ease the economic effects of the outbreak. Here's the Bank of England Governor Mark Carney.
The Bank of England's role is to help UK businesses and households manage through an economic shock that could prove large and sharp, but should be temporary. That's why the bank is announcing today a comprehensive and timely package of measures to help UK households and businesses bridge across the economic disruption caused by COVID-19. These measures will help keep firms in business and people in jobs, and they will prevent a temporary disruption from causing longer-lasting economic harm.
Mark Carney there. Also here in Britain, a health minister has tested positive for coronavirus. Officials are trying to trace everyone who had contact with her. The minister, Nadine Dorries, first showed symptoms on Thursday, and that's the same day she attended a Downing Street reception hosted by the Prime Minister Boris Johnson. She says she is remaining at home as advised. She's also said she's most concerned about her elderly mother. The UK doesn't yet have any restrictions on public gatherings, but a Premier League football fixture has fallen victim to the virus. Manchester City's game against Arsenal, due to be played on Wednesday evening, has been postponed, and that's because it's emerged that several Arsenal players were in contact with the owner of the Greek side Olympiacos after their Europa League match. Evangelos Marinikinis tested positive for the virus, although at this stage the English Premier League says the postponement is simply a precautionary measure. Well, the Governor of New York State, Andrew Cuomo, says he will send troops to enforce a containment zone to the north of New York City. The National Guard will deliver food to quarantine individuals in New Rochelle, where a 1 mile, that is 1.6 kilometres, containment zone is being put into place after the virus was discovered there. It comes as passengers left the Grand Princess cruise ship, which was finally allowed to dock in Oakland after a COVID-19 outbreak on board. Vice President Mike Pence has said new measures are being put into place to deal with the infections on board cruise ships coming to America.
I'm also pleased to report that we did receive this afternoon a comprehensive proposal from the cruise line industry, a proposal that includes advanced screening, improving medical services on ships, providing for airlift evacuation and land-based care at the expense of the cruise lines for anyone that might be not only infected with the coronavirus, but with any serious illness. Well,
just to give you an idea of some of the preventative measures being taken across the US, let's show you San Francisco right now, where city officials have assembled a fleet of 30 mobile homes, which will be used to help people who don't have their own accommodation to self-isolate if necessary. Currently, there are 14 cases in San Francisco, this initiative costing around $440,000.